Preparation of the donor scleral graft in the eye bank. The word sclera in Greek means hard. The sclera is the outermost layer of the eyeball. It is a white, opaque, fibrous, protective layer made of collagen and elastic fiber. The sclera forms the posterior 5/6 of the connective tissue coat of the globe. Anteriorly, the sclera is continuous with the cornea and posteriorly with the dura mater of the optic nerve. The sclera is innervated by many small nerves and blood vessels. The thickness of the sclera varies from 1 mm at the posterior pole to 0.3 mm just behind the insertions of the recti muscles. The sclera is essential as it helps to maintain the shape of the globe, offers resistance to internal and external forces, and provides a point of attachment for the insertion of extraocular muscles. When there is scleral thinning or full thickness loss of scleral tissue, then donor sclera is used as a substitute to maintain ocular integrity and to prevent intraocular infection. Donor sclera is used as a patch graft to cover the subconjunctival tube of the glaucoma drainage device. The patch graft prevents conjunctival erosions and tube exposure. Donor sclera is also used in the management of scleral melt or necrosis, in trabeculectomy with mitomycin C, and in bleb leak repair. Donor sclera tissue is inherently strong and flexible and an easy-to-handle avascular tissue which is well tolerated by the human immune system. Its natural curvature assures a better fit as a patch graft. The non-availability of the donor scleral patch graft limits its use. That is why at times we have to rely on alternatives. Other tissues like fascia lata, cartilage, periosteum, aortic tissue, skin or amniotic membrane are also used as substitutes for the scleral graft. We will now demonstrate the procedure of processing the donor eyeball to prepare scleral patch grafts. The procedure is easy to perform using laboratory agents available in any eye bank. Once processed, the scleral tissue can be preserved for a year and can be easily transported to different hospitals for use in ophthalmic surgeries. The instruments required for the processing of the donor eyeball to retrieve scleral graft include corneal scissors, right and left hand sides, simple scissors, toothed forceps, scalpel and blade. The reagents and storage solutions required for disinfecting, processing the donor eyeball and storage of the scleral graft include gentamicin antibiotic drops, betadine 5% solution, normal saline solution, absolute alcohol. The donor eyeball is screened to rule out infectious diseases before taking it up for processing. The donor eyeball is washed with betadine 5% solution for over 2 minutes, followed by wash with normal saline. The donor eyeball is then wrapped in a cotton gauze piece to facilitate dissection. After cleaning the attachments of tenons and extraocular muscle tissue, if any, the donor eyeball is washed with antibiotic solution. A full thickness incision is made in the sclera about 3 to 4 mm from the limbus, and the corneoscleral button is excised and separated from the rest of the eyeball. The excised corneoscleral button is safely transferred and stored in a vial containing Macaire-Kaufmann medium for later use. Blunt dissection is performed with a wire vectis and the intraocular contents and uveal tissues are cleared. The residual uveal tissue on the inner coat of sclera is continuously removed with the help of cotton buds. The scleral coat is thoroughly rinsed with normal saline. The scleral shell is dissected into 4 equal parts with the scissors starting from the limbal side and moving on to the posterior pole. Petal-shaped scleral tissue is dried with cotton gauze. An antibiotic solution of gentamicin and normal saline measuring 1 in 5 is prepared by mixing 5 milliliters of gentamicin with 20 milliliters of normal saline. The scleral tissue is dipped into the antibiotic solution for about 20 minutes. The scleral tissue is dried again and transferred into bottles containing 99.9% absolute alcohol for preservation. As 99.9% absolute alcohol is usually difficult to procure, we suggest that for your use, you make arrangements to purchase it from any supplier of pharmaceuticals. This scleral tissue is ready for use and can be preserved for about 1 year. The donor scleral material is excellent as a patch graft. It can be cut into the required shape and size. A patch graft with donor sclera helps to restore the structural and functional integrity of the globe. The donor sclera is advantageous as it helps to improve surgical outcomes in difficult ophthalmic surgeries. When used in glaucoma shunt surgeries, the patch graft prevents conjunctival and implant exposure. When using tissue adhesives to fix the scleral patch graft to the underlying sclera, first dry the scleral bed, as the presence of saline or aqueous in the interface may prevent adequate adhesion of the tissues. Alternatively, sutures may be used to fix the scleral patch graft to the underlying sclera. All in all, the donor scleral patch graft is a simple and cost-effective option that helps the ophthalmic surgeon to properly handle complicated cases of scleral thinning, tissue loss, or conjunctival exposure.